Good evening everyone. I'm Dr. Ashwin Tanankar. I'm a consultant in Uro-Oncology and Robotic Surgery Department as a part of Surgical Oncology Division at Apollo Hospitals, Navi Mumbai. I'm looking after cancers of urological systems, meaning cancers of kidney, ureter, adrenal glands, bladder cancers, prostate cancers, and male genital organs. You must have heard my previous talks about all these organ-specific cancers. Today we are here to talk about robotic surgery, and specifically we are going to talk about role of robotic surgery in prostate cancer management. So before we jump into the management of prostate cancer, I would quickly discuss about what a robot means and how the robotic machines act or help us in doing a surgery for a patient. So robot was first time installed or approved in year 2000 in USA. So it's been nearly 2 decades of phenomenal journey for the robotic surgery, and it's a sea change now in last 20 years. So where they started with a bulky big robots, they have narrowed down to a very minuscule small machines where the precision and the entire surgery is done in a very precise and concise manner. So what robot means, basically there is a myth amongst people that robot itself performs the surgery, which is absolutely not a truth. So basically it's a combination of three different varieties of machines. So one part of the robot is called surgeon console, where the surgeon actually sits into that particular machine, performs the surgery with the hands, with both the hands and both the legs together, where he has a three-dimensional magnified vision inside that console, which the vision is completely taken from the patient's body. The second part is called as patient cart, meaning that particular machine is mounted next to the body of the patient who is anesthetized, and the robotic small instruments will be going through the small ports, which will be like a keyhole surgery similar to advanced form of laparoscopic surgery. And a third part is a vision cart, where we have the vision and the energy instruments loaded onto the cart. So these three parts come together as a part of robotic surgery. The entire movement is completely governed and controlled by the surgeon in the console, and that movement is exactly reciprocated inside the body of the patient with complete precision and higher magnification. So in general, there is no autonomicity to the robot. So the understanding or a myth where patients would feel that the robotic surgery is like a program thing where surgeon is entering something and the surgery is taken care or taken over by the robot completely is absolutely not true. The complete surgery is completely governed and performed by the surgeon only on the console, and the entire movement is obviously synchronized. So this is how the robotic surgery works. We have small keyholes similar to the laparoscopic surgery. What all are the advantage of the robotic surgery in general? So obviously this doesn't stand true only for prostate, because the indications of robotic surgery are n number of folds into various departments. Talking about urological cancer surgeries, which I perform regularly, prostate, kidney, bladder cancer surgeries, even groin node dissections for the penile cancer surgeries are done now robotically. Apart from this, many other surgeries including kidney transplants for urological systems or pyeloplasties or simple nephrectomies are done robotically. Other systems which also, other divisions which also utilize robot for their routine surgeries are gynecological cancers, GI cancers or colorectal surgeries, including some other upper GI surgeries like esophageal surgeries or liver surgeries or pancreatic surgeries, and obviously the thoracic surgery. So it's the same robot will be utilized by different departments, and there will be some minor variations in the way which the robot functions, but in general advantage of the robotic surgery would stay same for every other branch. So what all are these advantages? One is you have a minimal invasive surgery, meaning you are doing a surgery through a keyhole, so you don't have big cuts on the tummy or big cuts on anywhere you are doing the surgery. It's an advanced form of laparoscopic surgery where we have a three-dimensional vision compared to a standard laparoscopic surgery where we have a two-dimensional vision. Here we have a three-dimensional vision. Just to simply say, we actually see a vision which itself mimics that we are actually sitting inside the tummy of the patient and doing the surgery inside. So that's an advantage of a three-dimensional vision. The fourth advantage of the robotic surgery is precise movements because we don't have tremors, because the entire machine is going to be, or movement is going to be performed by the machine. We have tremor escalation, or tremor miniaturization, I should say, more precision of the surgery, less of blood loss, magnified vision. The magnification is nearly 20 times. So it is the maximum amount of magnification which one can have inside the tummy of a patient. So these particular advantages would help us to have more precise movements. The dexterity is an important tool because we have both the arms working together, right arm and the left arm working together, and the precise movements are governed by both the sides of the arms, right arm and the left arm. The maneuverability of the robot gives us some specific advantage in terms of having 7 degrees of freedom, meaning there will be some restriction in the normal wrist movement of a human body, but the robot will give us 7 degrees of freedom in the joint which they have created, and that helps us to function or to have precise movements in a tricky locations similar to a prostate cancer surgery, where we are joining the bladder to the urethra after prostate is being removed. So these are all the advantages of the robot, and because of these, the recovery is fairly painless. You have faster and early discharge. Patients are started on the diet very soon after the surgery, and standard surgeries, patient generally walks out of the hospital as a part of standard discharge within 2 to 3 days of surgery. So coming to the prostate cancer now. So as you know, prostate cancer is a very common cancer. We have spoken about prostate cancer in the previous versions, but just to reiterate, it's the second most common cancer across the globe in gentlemen, and soon it will be the most common cancer. There is a very high incidence of prostate cancer, not just in Western countries, but in India as well. Because of little underreporting, we are lagging in numbers, but honestly speaking, they are equally similar to the Western literature, meaning it is the second most common cancer in India as well in gentlemen. In early stages, we have discussed about the PSA screening previously. So with the PSA testings between the age of 50 to 70 and the examination, based on any abnormality, we pick up early cancers. And advantage of picking up a cancer in an early stage is you're reducing the chance of mortality, you're reducing the chance of cancer getting detected in a late stage, and that helps us to treat the patient in an early stage for cure. So whenever the disease is in early stage where the disease is only limited to the prostate or surrounding structures, we have an option of removal of the prostate by performing a surgery called radical prostatectomy. Conventionally, this surgery was done in an open fashion, but since the inception of the robot, since year 2000, there has been a sea change in the robotic prostate surgery, and currently nearly 99% of the surgeries for prostate cancer are done by the robot across the globe. India is not lacking behind, and we are doing equal number of robotic surgeries as compared to the West, and because of the advantages which we have already discussed. So for prostate cancer specifically, what all are the advantages out of the robotic utilization? Apart from the precise movements, lesser blood loss, what specifically helps us to perform a surgery for prostate is because prostate is sitting right deep inside the pelvis, inside the bony pelvis of the patient, and hence the maneuverability or the vision is compromised in a standard open surgery, which is not the situation in the robotic surgery. You have a magnification, you have a precision, and hence you can spare the nerves sitting next to the prostate, which is a part of functional recovery as a part of surgery for prostate cancer. Because of this enhanced nerve sparing which we can offer with the robotic surgery for prostate cancer, there is a fair possibility of having regainment of the sexual functions for the patients undergoing this particular procedure. Another advantage which robot gives us for prostate cancer surgery is we can spare the bladder neck nicely. We can actually narrow down the bladder neck, remove the prostate, and join the bladder neck to the urethra directly. That helps us to have good urinary functional outcomes for the patient in the post-operative phase. And thirdly, the joint which we create between the bladder neck and the urethra, it is a little difficult task in a conventional open manner, which becomes much easier and precise, and the anastomosis of the joint becomes waterproof without any leaks on most of the occasions when we perform the surgery with the robot. So with all these advantages, the surgical outcomes have improved a lot. People have gone in Western countries or in US, people have gone to a single day procedure, meaning it's like a day case surgery. You're operating with the robot, and patient probably walks out of the hospital as a discharge on the same evening. We are nearly getting there. Currently, in Indian standards, our post-operative ward course for the prostate cancers is for approximately only 1.5 to 2 days, meaning if we do a surgery today, we probably are going to send the patient home either tomorrow evening or day after tomorrow in the day session. So 48 hours of post-operative stay, fairly painless recovery, and immediate resumption of the diet on the day of the surgery are the advantages of the robotic surgery for prostate cancer. So in general, talking about the insurance companies, majority of the insurance companies now are covering for the robotic charges. The robotic utilization is improved a lot, and hence the robotic charges are coming down day by day. So it's no more an expensive surgery, honestly speaking. If we have to see what is happening in the long horizon or what will happen in next 10 years because of the newer systems which will be coming into picture for the robotic surgery, there will be a lot of improvement in the functionality as well as reduction in the cost, and it will be a very cost effective surgery going forward. In general, currently at this point of time, robotic surgery helps us to have a better functional outcome and a better cancer outcome. So, for like I said, prostate cancer surgery would be evaluated twofold. One is cancer outcome because ultimately it's a cancer surgery, and secondly, functional outcomes in terms of urinary issues and the sexual function recovery. So, both these factors will be taken care of with the robotic surgery. We call it trifecta, meaning you're having a cancer control, you're having sexual function recovery, and you're having a good urinary outcome. So this is called as trifecta in the order of preference. So robotic surgery obviously has changed the way prostate cancer was managed previously. The indications of the cancer surgery also are expanding day by day, meaning in the open era, the indications of the surgery were limited to the cancers which are completely small in size inside the prostate. Obviously, they are the ones which are the best suitable candidates, but those patients who have younger age, or those who are already on a catheter and a disease which is slightly coming out of the prostate, we can offer a surgery by utilization of the robot for these candidates, and hence the indications are improving because of the better functional outcomes. Just to reiterate, robotic surgery gives us an advantage in terms of better precision, lesser blood loss, faster post-operative recovery, and better functional as well as cancer-related outcomes, especially for prostate cancer. Thank you so much.